Welcome back. COVID is on the rise again across the country and especially here in Florida. More than 100 people each week are now dying in Florida from COVID. In fact, more people are dying every week in Florida than any other state in the country. More than California, more than Texas, more than New York or New Jersey or Michigan. Florida also has the highest rate of hospitalizations due to COVID in the country. And the one thing the overwhelming majority of these people who are dying and who are hospitalized have in common is that they are not vaccinated. Nevertheless, our governor and his Surgeon General have come out and told people not to get the vaccine, to not trust the vaccine. The governor and the current Surgeon General, Dr. Joseph Ladapo, are focused on politics and not science. So I contacted the state's previous Surgeon General, Dr. Scott Rivkees, who DeSantis sidelined and then replaced. He is now a professor of public health at Brown University in Rhode Island. I asked him to explain what is happening now with COVID.
Yeah, so first of all, as we're going into our winter, late fall seasons where we see respiratory viruses, we really now have to actually think of the three major respiratory viruses, not just COVID: RSV, flu, and COVID. And right now, we're not seeing much flu. We're not seeing much RSV. We anticipate that will happen later on as we closer to winter. But we are seeing COVID. Cases of COVID in the United States have risen over the past month or so, as reflected in hospitalizations and individuals who have sadly lost their lives to COVID. But it's important to point out that even though we're seeing a rise in cases now, it's much less than what we saw about 8 or 9 months ago.
You were sharing some of the numbers a second ago as it relates to Florida. What are the Florida numbers that you see?
Yeah, so first, in terms of nationally, overall, in terms of how we're tracking things now, we aren't reporting cases like we had before and collecting that information. So we're really looking at hospitalization data and loss of life data to really get important screenshots in terms of what's going on. So in the U.S., over the past 2 weeks, cases have gone up by almost 20%. Almost 30,000 people hospitalized in the United States with COVID per week, almost 800 deaths per week. And in Florida, we aren't seeing the rise like we before. It looks like new hospitalizations have stabilized at almost 3,500 new hospitalizations a week, but about 100 people a week are dying from COVID in Florida.
100 people a week are dying, and you're saying 800 a week are dying nationally. Is that correct?
Exactly, sir.
1 out of 8 deaths are currently coming out of Florida for COVID?
Yeah, yes. Again, Florida is one of the most populous states in the country.
That still seems like a high number out of Florida, nevertheless.
Well, we are losing about 100 people a week in the state of Florida and about 800 people a week nationally.
And you talked about hospitalizations in Florida being around 3,500. My understanding is about 3 months ago, it was about a third or lower than a third of that number. So we are seeing that trend tick up, which again gets to the point of what I was starting to allude to, which is the importance of getting booster shots for COVID. I know that the CDC and the FDA have approved now the new booster shots for the new variant within COVID. Do you think it's a good idea to get those shots?
Yeah, first getting back in terms of what we're seeing and what we can anticipate. So first, in terms of how long we are protected against COVID, and this actually goes to flu after you've had an infection or vaccination, it's about 6 months. So, if we had a major surge about 8 months ago, and we've had people vaccinated and haven't gotten the updated boosters, we're going to see periods of time where population immunity goes down. And as we have new variants, which we have, we're going to see these rises in cases, which we are seeing now. And both for the flu shot and also for the COVID vaccine, the protection you receive really lasts about 6 to 8 months of time. So Now we're at a time where a new updated COVID vaccine has been released before the anticipated winter season, where we're seeing some cases now, as we talked about. So in addition to getting our flu shot, we can also get the COVID shot at the same time. And also for RSV, again, a new vaccine out there to protect against severe disease to be considered as well.
I'm wondering what your reaction was to your successor, Dr. Ladapo, coming out very strongly in telling people not to get the booster shot. What was your reaction to that?
Yeah, so first of all, there's several reasons to get vaccinated, not just if you're older than 65, but also younger. So first, these vaccines have an excellent track record against protecting against severe COVID. And by severe COVID, I mean people are hospitalized or have lost their life. Since the beginning of the pandemic, about 25% of deaths have occurred in individuals less than 65 years of age. And particularly if one looks at the pediatric population, there have been 1,700 deaths. Most of those individuals don't have underlying medical conditions. So this is why it's recommended recommended by the CDC, FDA, other leading medical organizations, that even if you're younger than 65 years of age, get the vaccine. It'll protect you against severe disease. Second is that we can also talk about long COVID. Individuals who have COVID can have lingering symptoms, and with the Omicron variants that we see now, the feeling is that up to 10% of individuals can develop long COVID, something that if you're vaccinated, it'll decrease the risk of that. And then the third thing is, from a community level, population level, the more people that are protected against COVID, the less of a spread in the community, less of a spread, particularly to individuals who may be especially at risk, individuals who are older, individuals with underlying medical conditions. So this is why CDC, FDA, leading organizations recommend that individuals, including those less than 65 years of age, 6 months of age and older, avail themselves of the vaccine.
But not the Florida Surgeon General currently. And so I'm asking, as a scientist, as a doctor who clearly has an understanding of this issue, were you disappointed to hear Dr. Ladapo tell people under 65 not to get the vaccine?
Well, I'm going to come back. Let's look at the facts. 25% of the deaths that have occurred in people from COVID have been in individuals less than 65 years of age, including younger individuals, including children.
One of the reasons why Dr. Ladapo is telling people not to get the vaccine is because he believes it may not be safe. What can you tell me about the studies that you've seen as it relates to the safety of the COVID-19 boosters?
Yeah, really important question. And again, I want to refer people to the CDC website for the advisory committee on immunization practices, because the data are there. And what the data show is that these vaccines are very effective in preventing severe COVID, which is COVID resulting in hospitalizations and in deaths, and that these vaccines have an excellent safety profile. One of the concerns that had been raised is the risk of myocarditis. First, viruses can cause myocarditis. The risk of myocarditis due to COVID is much greater than the risk of myocarditis getting vaccines. But the most recent information that were presented, based upon the fall boosters that we saw last year, that there were 2 cases of myocarditis out of 650,000 doses. So that's an excellent safety profile.
And let me just jump in. And just to be clear, of the people who get hospitalized, of the people who die from COVID, what percentage of them have been vaccinated versus not vaccinated?
Yeah, based upon my conversations with individuals in hospitals, healthcare sector, caring for these patients, overwhelmingly, the vast majority of individuals who are being hospitalized now, passing away from COVID, have not been vaccinated.
I got my updated vaccine and flu shot on Thursday.